Well, it's now 6/19, and almost every woman fears breast cancer. If you have a close relative who's had the disease, the worry can be even greater.
Genetic testing can offer some peace of mind, but what do you do if you learn you're at high risk of getting the disease? Yeah, with us now is Dr. Alison Conlin, an oncologist with Providence Cancer Center. Dr. Conlin, how are you this morning?
I'm doing great. Thanks. How are you guys?
Very good. Interested to hear what you have to say here. What puts a woman at high risk for breast cancer?
You know, we've done a lot of work and identified a lot of risk factors for breast cancer, and some are more common than others, but I'd say, a real common one is family history, and real close family history, like your sister or your mom, or your sister and your mom with breast cancer. There are some other high-risk features that are relatively rare, like getting radiation from a prior cancer before you're 30, but really the types of people we're talking about are maybe people who have a very strong family history or other specific kind of things.
So we know that all women should do monthly self-breast exams and also have regular mammograms starting at about 40. But if you have a high risk of breast cancer, what other things are out there that you can do or should do?
Yeah, if we're able to really identify that, we truly can say you have a high risk for breast cancer, doesn't mean you're going to get it, but it means you might want to look more carefully to make sure you catch it early. And there's this, newer technology called breast MRI. People have probably heard of MRIs, but this one is of the breast, and that can be a more specific technology in women who are high risk.
Are these tests absolute or just a starting point to hopefully make some educated decisions?
The test also just sort of look if you're carrying a genetic mutation, a BRCA mutation, the one Angelina Jolie came in and talked about. Those tests are really good. There are people who probably have risk who we're not going to have a test for. So they're not absolute. We need to really talk to women a lot about their choices.
So it's common enough that you guys, Providence has a cancer center that has a high-risk breast cancer clinic. What can women expect there?
Yeah, it's a great clinic. It's really a lot about education. We really talk to women about what is their real risk. I think some women think their risk is higher than it is, and some women maybe find themselves there and learn some new things, and really just lifestyle changes. Plus, there are medications women can take to reduce their risk.
And we're almost out of time, but you mentioned lifestyle changes such as?
Keeping a healthy body weight, limiting alcohol intake. Alcohol is a risk factor for getting breast cancer. Maybe avoiding estrogen after menopause and eating a lot of fresh fruits and vegetables.
Exercise, too, I would imagine, always, right?
Absolutely.
Okay, good advice. Thank you, doctor.
Thanks.
Dr. Alison Conlin is an oncologist with Providence Cancer Center.